U.S. coronavirus hospitalizations have crept higher as states increasingly loosen COVID-19 restrictions and try to return to some semblance of normalcy, former Food and Drug Administration Commissioner Dr. Scott Gottlieb told CNBC. We now see a trend in an uptick in hospitalizations. It's a small uptick, but it is an uptick and it's unmistakable, and it is probably a result of reopening, Gottlieb said on CNBC's Squawk Box. We are going to have to watch it. Hospitalizations are a key indicator that epidemiologists watch closely to understand the state of the outbreak. Hospitalizations are not as dependent on the availability of testing as other closely watched measures such as the number of new cases, which is constrained by the number of tests deployed and delayed by shortages of equipment like swabs. However, hospitalizations are likely a lagging indicator of the underlying reality, because it can take weeks for people to become infected, develop symptoms, get tested, receive test results and become sick enough to be admitted to a hospital. We expected cases to go up and hospitalizations to bump up when we reopened, and I was talking to a lot of states about their plans and they were expecting that there was going to be an uptick, said Gottlieb, who sits on the boards of Pfizer and biotech company Illumina. Pfizer has a COVID-19 vaccine under development. That's why they all implemented very staged reopenings where they reopened in phases and then reassessed the data to make sure that any increase wasn't an inordinate increase. Every state has now reopened non-essential businesses and eased at least some restrictions meant to curb the spread of the virus. However, states are moving at vastly different paces. Wisconsin reopened overnight after the state's Supreme Court overruled the governor's stay-at-home orders, whereas New Jersey has kept most non-essential businesses closed. Some state officials, including Georgia Governor Brian Kemp, made the announcement to reopen despite failing to meet the criteria set by the White House, including a sustained drop in new infections for at least 2 weeks. Florida, Georgia, Virginia, Alabama, Maryland, Mississippi, Wisconsin, Minnesota, Ohio and Arizona have all seen a small uptick in hospitalizations, said Gottlieb, who is a CNBC contributor. CNBC could not confirm the data Gottlieb referenced, as not all states make hospitalization data available. There are hopes that the virus will spread more slowly during the warmer summer months even as people begin to intermix more, Gottlieb said. There's little evidence at this point to indicate that COVID-19 is a seasonal virus, but other human coronaviruses have shown seasonality, with most cases peaking in the winter months. The hope is that there's a seasonal effect here, Gottlieb said.